Welcome. My name is Danielle Greene, and I am the Executive Director of State and Local Public Health Initiatives at the CUNY School of Public Health and Health Policy. The presidential election is around the corner. So everything we do in public health is determined by the civic process. Whether it's the legislation and administrative rules that set up standards for keeping our air and water clean, or rules about who gets access to health insurance and what health insurance will cover, or budgetary decisions at the local, state, or federal level about things like rat elimination initiatives and the number of sanitation trucks and how frequently we have trash pickups, to judicial decisions that protect bodily autonomy and the right to health and basic care. Voting is how you select the people who will be making those decisions and how you let the people in power know how you feel about these issues. It's very easy not to think about public health or preparedness until there's a crisis or emergency. When public health is doing its work best, it's invisible and it's preventing things. But that makes it easy not to invest in it. So then we don't know what we're lacking until a crisis or emergency occurs. And then we see all of the gaps as we don't have the resources or infrastructure we need to respond to that emergency. And worse, the most under-resourced and marginalized communities are impacted the most by the emergencies. So we need to choose elected leaders who understand this and the need and will invest in prevention and preparedness so that we have the platform we need to work from to respond when the next crisis occurs. So Congress sets the budget for federal government, and the process begins. There's something called appropriations, where the Senate and the House each propose a series of funding bills and negotiate them. Earlier this summer, the House's proposed funding bill for health and human services included recommendations to consolidate the number of institutes under the NIH, the National Institute for Health, to reduce repetition and duplication. It also proposed eliminating funding for the National Center for Injury Prevention at the CDC. You may know that that is where gun research is housed. When you combine proposals like this, which did not pass, there is currently no budget bill. They're discussing a stopgap funding measure to get us from the end of the fiscal year through the election and beyond. And the Senate did not support these cuts. But when you combine just the idea of these cuts with things like recent SCOTUS decisions, which overturned the Chevron doctrine, which is a legal philosophy that allowed the subject matter experts within the administrative agencies, such as the Environmental Protection Agency, to interpret the laws and administrative rules. And instead, those interpretations are now going to be made by politicians. You have an undoing of public health protections. Project 2025 is an agenda or blueprint for how you could run and fund the government that encapsulates a similar philosophy to that is behind the House budget and the overturning of the Chevron doctrine. So when you think about who you want to vote for and what kind of public health you want for your community and the country and what kinds of issues you support, you should take a look at that and see if it aligns with what you believe and vote for people who will enact the policies